Perimenopause and menopause bring surprising changes to a woman's body. Doctors have been helping women manage many of the symptoms and conditions that can happen along with that, and now 2 more drugs are available to help. Founder of Ms. Medicine, a national organization raising the standard of care of women's health, Dr. Lisa Larkin is here to explain. Okay, so for years and years, women kind of went with no relief.
Right.
But now there are a couple of things, treatments that were approved by the FDA. So what are they, Lisa?
So it's exciting times in women's health. So finally, there's a lot of research and development, and 2 new drugs have been approved recently.
Okay, so
the
one
first
is for
one,
a common sexual disorder, right?
So one is a medication called Vyleesi, which is a medication for hypoactive sexual desire disorder, a disorder that's very common. 1 in 10 women have it. And this medication is the second on the market for this disorder. The first one was approved a few years ago called Addyi. This medication is an injectable medication that you use 45 minutes prior to sexual activity. It affects a brain receptor, a neurotransmitter called melanocortin. It lasts for 14 to 18 hours to improve desire. Now, this is in premenopausal women, used in premenopausal women who don't have another reason for low desire, such as another medical illness, a medication, or marital issues.
So this is for before menopause.
Right.
Now, there's been a lot of controversy about hormone therapy and menopause, but now the FDA has actually approved a treatment that's related to hormone therapy, right?
Well, so menopausal hormone therapy has been on the market for a long time, but I'm very excited about this product called Bijuva, because this is the first oral combination bioidentical hormone therapy. So there's a lot of women out there who hear the term bioidentical. There's a lot of compounded hormone preparations that women are receiving.
Which doctors' groups do not approve,
which ACOG and NAMS do not support. And this is a FDA-approved oral medication, so women know what they're getting, and it is bioidentical. And I think it's a really good option, again, for treating menopausal symptoms in appropriate women.
Okay, so what symptoms will this help?
Hot flashes, night sweats, the classic sleep disturbance related to menopause, which the majority of women actually experience for several years around that last period.
Are there women who should not use this treatment?
Well, so certainly there's a risk for hormone therapy in women who've had a history of breast cancer, and so hormone-sensitive malignancies are a big thing. Prior clotting disorders, previous cardiovascular disease or stroke. So yes, patients, young women going through the menopause transition, and young I define as 50 at this point, or 51, but who are healthy and symptomatic are very good options. This is a very good option for them.
Okay, now we just learned earlier this week that there is a breast implant that is problematic.
Right.
And you wanted to talk about that real quickly.
So this is, I think, really important to many women. So many women have cosmetic breast implants, and obviously breast cancer survivors have implants. The FDA this week made the decision, and I think the correct decision, to recall a very specific type of breast implant made by Larkin. And this is what's called a textured implant. So there's a coating on the outside of the implant and this was developed to keep the implant in place. And it's now been determined, although it's very rare, that these implants are associated with a specific type of lymphoma.
Or cancer.
Yes, it's a type of cancer, not breast cancer. It develops outside the implant. But it's significant and definitely associated with this type of implant. There's been over 500 cases reported worldwide, 33 deaths related to this.
Now, I know
and there's hundreds of thousands of women that have these implants.
Right, and I know that they told people not to necessarily take out the implants, but watch for some symptoms.
Right,
which are?
So it would be swelling or a palpable fluid collection around the implant. And again, many women are very concerned, and I've already seen patients who have come in and want to know the data and should they take these implants out. And I really encourage women to, this is rare, this is important to know about, and you should absolutely discuss with your physician. In breast cancer survivors, it's hard because sometimes the complexity of the surgery to remove the implant and replace them may be a more significant risk than actually the lymphoma. Now, so it's not clear, and it's really a very individualized discussion with your physician.
Yeah, and it was the Natrel implant made by Larkin, which Dr. Larkin
Only
mentioned.
about 5% of the market.
Okay, thank you so much.
Thank you.
Great information. We'll be right back.